Well, good afternoon, everyone, and welcome to the COVID-19 update for Thursday, December the 10th. Before we begin, I want to wish all who celebrate the Festival of Lights a happy first night of Hanukkah. As with so many other religious and cultural traditions, in Judaism, this holiday season is a time for hope and for warmth and for giving. It's a holiday that celebrates a miracle, and it encourages sharing hope and faith with others, knowing that our candle will never dim when we protect our neighbors from being left in the dark. Those lessons ring true in these difficult times for people of every faith. And throughout this pandemic, I've been exceptionally moved by all the ways in which I've seen Illinoisans share the light wherever they can. And I'm very certain that we'll come out of this on the other side stronger for it. I'm very pleased to offer a warm welcome home to the 150 soldiers of the Illinois National Guard's 105th Chemical Company, who have spent the majority of the last year serving in the Middle East. Their normal work, which includes protecting our forces and, of course, the nation from chemical, biological, and nuclear threats. But in this pandemic, their jobs also have included COVID-19 decontamination work, and I am so grateful for all of their service, both overseas and here at home. As we fight through the devastating economic effects of COVID, I want to make sure that everybody knows that we have financial support available for small businesses that have suffered during this pandemic. Applications for our Illinois Small Business Assistance Program, the Business Interruption Grants, will close at 5 p.m. Tuesday, December the 15th, and that's just 5 days away. Since we launched the BIG program in June, making $540 million available to small businesses, with $270 million reserved for child care businesses specifically, we've seen an enormous response, which speaks to the challenges that are faced by so many of our small businesses. For the $270 million devoted to all small businesses, to date, our Department of Commerce and Economic Opportunity has so far paid out more than $168 million to over 6,300 small businesses, spanning over 500 cities around the state of Illinois. More funding remains, and we expect to continue issuing grants through the end of the year until the full $270 million of allocation is exhausted. Special consideration is given to businesses in heavily impacted industries, businesses located in areas hard hit by the pandemic, especially those in downstate communities, businesses with annual revenues of $5 million or less, and businesses that have not received other forms of emergency assistance like PPP. The BIG program provides grants ranging from $5,000 to $150,000, with an average grant size to date of $25,000. Grant funds may be used toward operational expenses, including PPE, rent and utilities, payroll, and more. Really, any of the costs associated with keeping the businesses running, and which have been made all the more difficult because of the pandemic. If you own a small business, or you know someone who does, make sure that they take the time to submit an application if they qualify. DCEO and its outreach partners can provide technical assistance to walk you through the application process if you need it. For more information, visit illinois.gov/DCEO. And because communities, like businesses all across our state, continue to battle the economic impact of COVID-19, I want to remind folks that our Local Cure program, supporting local governments, is also ongoing. To date, nearly $147 million has been paid out or is already on its way for payment, supporting 688 cities, towns, counties, health departments, with funds to offset some of the enormous costs incurred during the COVID-19 emergency response. However, hundreds of local governments have yet to take steps they need to register for this program. And we encourage them to do so soon, so that together we can ensure that no federal dollars are left on the table and that every community has access to economic support. At the beginning of the week, I said that I was hopeful that some of the recent early improvement in our COVID leading indicators will continue. And I'm glad to say that we have yet to see a reversal in our progress that would dash that hope. Though again, we are not out of the Thanksgiving surge period yet. We unfortunately still have hundreds more Illinoisans in the hospital fighting COVID-19 than we did at our spring peak. But we're also hundreds below our overall pandemic record to date of November 25th. And remember, these are all on 7-day rolling average bases to account for single-day anomalies. All that said, I cannot overstate how preliminary this progress is. We are at a time of year when traditional gatherings are usually abundant, and because of the severity of this pandemic, it's really never been more important not to do so. So mask up, keep your distance, and plan smaller, more intimate holidays this year with members of your household. It's the best thing that we can do to show each other that we care during this unusual holiday season. Thank you, and with that, I'd like to turn it over to Dr. Ngozi Ezike.
Thank you, Governor, and good afternoon, everyone. We are learning more every day about vaccines for COVID-19, including information that will be coming out from the FDA about the emergency use authorization for the Pfizer vaccine maybe momentarily. I know that there's concern about the COVID vaccine. As the public health leader for the state of Illinois, I want people to know that I will be getting the vaccine when it's my turn and when it's available and after approval by the FDA and recommendations by the Advisory Committee on Immunization Practices. I do trust in vaccines. I trust in the development and approval system that has been created in this country. And from what is known, the safety and the efficacy of the vaccine has been evaluated appropriately. As a physician, I would recommend that unless you have a direct medical contraindication, if it is approved by our FDA, that you get vaccinated. I encourage people to learn for themselves from medical research experts about the vaccine and be able to discern the myths from truths. There is a lot of misinformation, so please obtain credible medical research expert information as opposed to just social media myths that are going around. Only when people adjust their personal behaviors with the mask and the distancing and the avoidance of gatherings combined with the vaccination will we get to end this pandemic and get to our normal way of living. As the governor mentioned with the end-of-year parties, I urge you not to plan an end-of-year party or a holiday party in the large gatherings that we're used to, but start planning for the end-of-pandemic party for next year. Today, we are reporting 11,101 individuals who were newly diagnosed with COVID-19 for a total of 823,531 total individuals with COVID-19 in Illinois. Unfortunately, we also have report of 196 individuals who lost their battle with COVID, bringing the total number of individuals who have been lost to COVID in Illinois to 13,861. In the hospital overnight with COVID were 5,138 individuals, 1,081 patients were in the ICU, and 606 patients were on ventilators. In the last 24 hours, more than 114,000 tests have been reported for a total of almost 11.5 million tests. While it will take many months for the vaccine to be widely available, please see with me that the finish line is in sight. We've come very far. Let's keep going and let's get everybody to the end of this marathon and get back to normal altogether. Thank you. And now the comments in Spanish. Hola a todos y buenas tardes. Cada día aprendemos más sobre las vacunas para COVID-19, incluyendo la información de la FDA sobre la autorización de uso de emergencia para la vacuna de Pfizer. Sé que existe preocupación por la vacuna, pero como líder de salud pública del estado de Illinois, quiero que la gente sepa que yo voy a recibir la vacuna cuando esté disponible y sea elegible. Confío en el sistema de desarrollo y aprobación de vacunas que hemos creado en este país y que la seguridad y eficacia de la vacuna es una prioridad. Animo a las personas a que lean los hechos científicos sobre la vacuna y combatan los rumores y la desinformación que ya está circulando. Solo si las personas se vacunan, además sus comportamientos, usar una máscara, evitar reuniones y mantener la distancia, pondremos fin a esta pandemia. Hoy informamos 11,101 personas recién diagnosticadas con COVID-19 para un total de más de 823,000 casos. Desafortunadamente hay 196 muertes. Eso eleva el número de vidas perdidas en Illinois a más de 13,800. 5,138 personas estaban en el hospital durante la noche con COVID-19. 1,081 pacientes estaban en la unidad de cuidados intensivos y 606 pacientes estaban en ventiladores. En las últimas 24 horas se han reportado más de 114,000 pruebas para un total de más de 11.5 millones de pruebas aquí en Illinois. Se necesitarán muchos meses para que la vacuna esté ampliamente disponible. La línea de meta está a la vista. Hemos llegado ya a este punto, pero tenemos que seguir para terminar con este maratón. Muchísimas gracias para su apoyo. And with that, I'll turn it over to Governor Pritzker.
Thank you, Dr. Ezike. And before I take questions, I want to provide an update on our efforts to protect the heroes in our state-run veterans homes from this pandemic. As the United States has experienced this fall into winter resurgence of COVID-19, so too have we seen COVID-19 cases and deaths in our nursing homes rise nationally amid growing community spread. Unfortunately, Illinois is not immune from this trend. At the LaSalle Veterans Home, 38 of 93 residents are currently positive for COVID-19, along with 3 staff members. To date, I'm deeply saddened to report that we have lost 1 more resident at LaSalle to COVID-19 since my update on Monday. Since the current outbreak at the home, every employee is tested with rapid result antigen tests prior to every shift, and residents are tested every day. In recent weeks, this protocol has identified 6 asymptomatic staff as carriers, and as a result of that identification, they were able to isolate. Working with our IDPH staff at the home, an infectious disease specialist from the U.S. Department of Veterans Affairs has been on the ground at LaSalle following up on all pandemic and broad level concerns and protocols. We are also experiencing an outbreak at our Quincy Veterans Home, though it is currently primarily limited to 1 residential building within the home, and staff do not work among multiple buildings. DPH staff, as well as a federal DVA specialist, have been on site in recent days. The Quincy complex has 6 separate buildings home to residents, with anywhere from 2 to 5 units per building. At Quincy, 32 of 293 residents have tested positive for COVID-19, along with 22 staff members testing positive. Staff and residents in 2 of the buildings are tested daily, with rapid tests conducted on all staff at all shift changes. The other 4 buildings, which are separate and do not share staff, are being tested twice weekly. Of our remaining veterans' homes, Manteno in Kankakee County has 3 of 169 residents and 4 staff who are currently positive for COVID-19. The 2 remaining facilities, Anna in Union County and Prince, the additional site on the Manteno campus, have both had 0 residents and 0 staff receive a positive result in their most recent tests. Early in March, the Illinois Department of Veterans Affairs restricted visitors at all homes outside of required personnel, home employees, healthcare professionals, as well as CDC and IDPH staff. Staff have been provided with full PPE and trained on how to wear it for maximum safety since the very start of the pandemic, and numerous additional protocols aimed at reducing the potential for an outbreak have been implemented, such as an increase in testing. When regional positivity rises, as it has statewide this fall, testing is necessary. We also have the Illinois National Guard on the ground assisting efforts at LaSalle, with their arrival at Quincy and Manteno set for Monday, providing staff support for screening and handling testing, data tracking, so that medical staff can focus on direct patient support. 2 days ago, I was asked here about National Guard being deployed to our homes, and I dismissed it as a rumor. In retrospect, I had directed every member of my administration to move quickly to respond with every available resource to assist IDVA, and National Guard was asked to be of assistance before I was made aware. That's a good thing. I want my administration to be nimble and responsive, but I want to apologize for being dismissive when I was asked about it. I will say this is just one example of how we are directing every available resource to our veterans community through this period of exceptional risk. Here in Illinois, we will leave no stone unturned in our efforts to safeguard our most vulnerable, especially those who lived to serve. And with that, I'm happy to take questions from members of the media. Craig?
Governor, your own numbers show that in the last 7 days, 10,031 deaths, up from 866. That's a 19% jump from just a week ago. Is this the Thanksgiving surge, and are you concerned it's going to continue to rise the way it has?
You're citing death numbers. Is that what you were referring to? Sorry, I didn't hear what you said.
Yes.
So I want to remind everybody that there are leading indicators and there are lagging indicators. And, the death numbers are lagging indicators. We are not far enough from Thanksgiving that those numbers are reflective, in my opinion, of as a lagging indicator of Thanksgiving. It's my view, and I'd be happy to have Dr. Ezike provide hers as well, that those are, you saw a tremendous rise before we put Tier 3 mitigations in place, although we had Tier 2 and Tier 1 in place for a few weeks before that, that it's because of the rise in cases before that you would see death numbers as you've seen them more recently. It's one of the most confounding things about this virus, honestly, is the time lag between the time that someone is detected to have COVID, maybe even asymptomatically at first, and the time that someone ends up in the hospital, and then possibly someone ends up in an ICU or on a ventilator at some point, and then unfortunately may pass. And it is confounding. I mean, it is. You can look at the numbers over the last several days and see that the numbers in terms of leading indicators are going, generally speaking, in the right direction, or they're plateauing, and that's better than going up. But you watch the numbers of people who have passed away that are reported at the same time, and you say, what's happening here? Why do those look so terrible? And unfortunately, those are, or maybe fortunately, I don't know how you want to look at it, those are related to something that may have happened weeks and weeks ago.
Dr. Arwoody in Chicago has indicated they're starting to see in Chicago an uptick in cases, and she, I think, has indicated that she thinks this is the beginning of a post-Thanksgiving surge, at least in the city.
Yeah.
You know, what's going on in the city versus the state? Does this portend anything for the rest of the state? It's
hard to tell, honestly, Eric. You can't tell exactly from one region what the rest of the state is going to do. And that's one of the reasons we have the state divided up into regions, is that they can more easily jump on outbreaks and an uptick in numbers at a local level or a county level than even we at the state level can, and certainly more granularly can do so. And so, look, we've seen the state positivity numbers going down. And that's a good thing. And you've seen that we had a number of days below 10,000 cases. This was the first day in some time, when we had something above 10,000 or, at 11,000 some. But if you look at the positivity rate, it's still below 10%, at least on a one-day basis. And then it's now moved for case positivity below 10%. On an average for a 7-day period. So I don't want to make any pronouncements about what this means for the future, about the city of Chicago moving in another direction. But I can just say that we're watching very closely the numbers. I do not think we're out of the Thanksgiving surge, if that's the question. I think that we have to stay on it every day, focus on it, and keep moving these numbers, generally speaking, across the state in the right direction. And I'll assist any city, county, region that needs help from the state. That's what we're here to do. We want to help everybody move this in the right direction. Yes?
Hi, Governor.
How are you?
Long time no see you.
Good to see you.
We're hearing that the vaccine distribution program will require state governments to share data with that can be also shared with federal agencies. As a matter of fact, New York State has proposed a modified identification system in order to protect some immigrants, their status. Is Illinois doing anything? Have you put any thought into this? And can you ensure our immigrant community that their private information would fall into the hands of DHS or ICE for what matters?
Dr.
Thank you, Dr.
Yeah. We will protect the information of all the people who get this vaccine. We want to make sure that the message is clear that everyone can get this vaccine, and it's free to everyone, no cost to everyone. Yes, we need to make sure that we give numbers in terms of people who are getting immunized. The state has to have that so that we can know which areas have been vaccinated, which areas haven't, which ethnic groups, which neighborhoods, etc. But we will do all that we have to do to make sure that we protect the status of everyone who gets the test, and we don't want anyone to be discouraged in any way from coming forward to get this important resource once it's available.
Do you feel comfortable saying that in Spanish, please? Or
Es muy importante que todas las personas saben que esa vacuna está para todos. No necesito ningún documento, ningún papeles para asegurar que está ciudadano o no. Y voy a hacer todo lo necesito para proteger la identidad de cada persona para asegurar que no hay problemas con eso.
Professor Ziegler, while you're still up there, can we ask you a follow-up question just related to the vaccine, if we might? We're hearing people having allergic reactions and other things as Britons and others who are starting before us, things come out. Do you have concern that there could be a growing lack of buy-in for people to get the vaccine?
I think there's going to be a different situation for each person. Just as I mean, any kind of decision that has to be made, there are a lot of internal thoughts and factors that have to be weighed in, depending on what your experience has been with health or public health. You may be coming to this from a different perspective. I think many people, I think more people than not, are interested in getting this vaccine, and the job of the public health department of the government is to ensure that everyone has the adequate information with which to make the best choice for themselves and their families. So it's not going to be about coercing anyone, it's about communicating with everyone, making sure they have the right facts to make the best decision. We can't assume that every single person will want the vaccine for any number of reasons, but we have the expectation that we will be able to have accurate information available to everyone to make the best decision possible.
We'll do one more in the room and then we'll go online.
Regarding vaccines, we've talked to a couple local public health departments. They're setting up websites for people to register, to get text messages, to list their comorbidities, to say, yes, I am an essential worker or not. But what about those folks who may not have access to the technology or not tech savvy, may not even have a regular medical provider? How do you keep those folks from falling through the cracks?
Right, so that's why the effort when we have a vaccine that's more readily available to everyone will involve many different sectors of the community. We already know that for some of the people that you're referring to, FQHCs are a wonderful setting. They see people regardless of their ability to pay. Everything is scaled from no pay at all to whatever might be the appropriate payment. So that is going to be a big partner going forward. But we also are going to be having mass vaccination drives in parking lots, in malls. We're going to use our community-based testing sites to try to, as well as testing, be able to have a line where you can have vaccination once it's readily available and you don't have to sort out if you are of this priority group or not. So it's going to take all hands on deck, getting as many providers as possible to make sure that there aren't groups that are left out. And that's why at the state level, with our registry system and the requirement that every dose has to be logged in, we will be able to see if there are communities or pockets that aren't having that same uptake. And then we can look, because sometimes it might be that it was available, but people didn't want it, and then trying to increase any outreach efforts to see if there are additional questions or concerns that people have. But I think over time, more and more people will say, oh, I think I want it now. I think there's some people who may not want to be the first, but I think with time, you'll have more and more uptake. And so we have to have people get to it in their time, and we will provide all the information to help them make those decisions.
Jim Haggerty at the Rockford Advocate. Governor, Illinois Representative Joe Sosnowski is again calling on you to lift restrictions on bars and restaurants, claiming they are not the culprits for the current surge. Can you comment on that and what you said yesterday regarding airborne transmission?
Well, I can appreciate, I know that Representative Sosnowski all along has not believed that bars and restaurants have anything to do with transmitting or amplifying the disease, but he's wrong. And medical studies, medical doctors, epidemiologists, experts on infectious diseases all have nearly universally said that bars and restaurants are places, because people are not wearing masks for lengthy periods of time, because they tend to be indoors for lengthy periods of time, that those are places that can be dangerous for people. And so, again, I would be happy to resend to Representative Sosnowski the studies that have been done by all of the reputable scientific institutions that have done these, and they are reputable. These are international and national institutions. Not to mention, I might add, many, many states around the country who have now closed indoor service to bars and restaurants because they have had record surges of COVID-19, and that has helped them to tame those numbers.
John O'Connor at the AP. Is it true that counties without hospitals are donating their vaccine doses to their regional hubs so that the regional hub staff are a part of the first wave? How many counties and how many vaccines?
There were 7 or 8 counties that were initially slotted for that initial allocation that don't have an actual hospital in their county. Sorry. And so we have reached out to every single one of those counties to work on the appropriate reallocation of that vaccine, whether it's to the hospital that those residents of that county would seek their care at, or the regional hub, and to ensure that all the regional hubs get some vaccine to start the process. So yes, we have identified when we made the list that absolutely some counties don't have a hospital, but they have had people with COVID and people who died with COVID. So those people are getting care somewhere, and so we will still get those healthcare workers immunized.
But sorry, I just want to make clear, though, that you remember that long-term care facilities also will be receiving very early doses of the vaccine, and those will go directly, whether it's in a county that was named or one of those 7 or so counties or not, those will go directly to those long-term care facilities, nursing homes, and people will be vaccinated there, including staff.
Dave McKinney at WBEZ. Realizing Mike Madigan's fate as Speaker still rests with House Democrats, Governor Pritzker, could you tell us your own sense about what Madigan's legacy will be on Illinois politics, the Democratic Party here, and the state's overall ethical climate?
Well, I think that will ultimately be a decision made by historians. There are a lot of decades to cover of leadership in the role of the Speaker. And so that's very hard in the near term circumstance to look at what the Speaker's legacy might be. But there's a lot to examine. Certainly, anybody who was Speaker of the House now, who was at the 1970 Constitutional Convention, there's a lot that's occurred in those 50 years.
Shruti at Bloomberg, what phase do people who have already had COVID-19 fit into for Illinois' vaccine distribution plan? Will they be in later phases or at the end?
No, they're not segregated out of the phases. The definitions that ACIP has laid out include, consider people who have had COVID before, but happy to have Dr. Ezike elaborate.
They did stipulate in the ACIP guidelines that people who have had COVID within the last 90 days should hold back and let others get the vaccine because we think within that 90 days you can't get COVID again. We can't say for sure after that. So if it's been more than 90 days, then it could be appropriate to get the vaccine at that time.
Will that apply to medical healthcare workers if they've had it?
That's anyone with, yes.
Dean Olson at the SJR, is it true that people who receive COVID-19 vaccine shots are prohibited from getting on an airplane for 6 months? If that's true, what impact will it have in Illinois?
I haven't heard anything like that. Have you, Dr. Ezike? No. And I spoke with an airline executive just this morning, and we had a fairly extensive conversation about passengers, workers, and so on, and the vaccines, and none of that came up.
Jake Griffin at the Daily Herald for Dr. Ezike. HHS released a report on hospital usage dating back to July that shows some hospitals struggling to find space for patients while other nearby hospitals aren't as full. What can the state do to fix this issue, ensuring patient safety?
Right. Well, there's already an internal system, if you will, between hospitals where if there's a need to transfer, one provider, one doctor talks to a doctor at another hospital and arranges for transfer. So fortunately, we have not gotten in a situation where there are no beds available in a region. That's what we're trying so hard to prevent. So there are avenues for transferring patients. Again, there's all the red tape of which insurance you have and what places you can be transferred, et cetera. But there's never been a situation where there's a region where there was absolutely no place to go. But there may be individual hospitals that have been full, but with surrounding hospitals with some available beds.
Peter Hancock at Capital News Illinois. IDES reported today that first-time unemployment claims surged 45% in 1 week to more than 107,000. How much of this do you think can be attributed to the stricter Tier 3 mitigations?
It's hard to tell. Remember that there are a lot of things that affect employment that occur long before just a couple of weeks ago. We've seen layoffs of major companies that were in the works for some number of months now. So I can't answer that question.
Paris at WTTW, how much of the initial shipment of the Pfizer vaccine will come from the Pleasant Prairie facility? Wisconsin lawmakers say there are regulatory hurdles to shipping the vaccine across state lines. Do you anticipate any regulatory hurdles?
No, there are not going to be any hurdles, and the vaccine will be able to ship easily through the state of Illinois and into the state of Illinois.
Hannah Mizell at NPR Illinois. Governor, the State Ambulance Association is suggesting that the state's distribution of federal CARES Act money is extremely delayed, and the formula that was created by the Illinois Department of Health Care and Family Services gives very little money to the largest ambulance providers who are doing the most COVID transports. The ambulance providers suggest they are struggling to keep their EMTs safe during the pandemic and need this money from HFS to keep essential workers safe. Are you aware of this concern?
Well, that sounds concerning, and I can just say that I'd be happy to connect you with the folks at HFS. In fact, I'll ask Jordan, my press secretary, to do that, to make sure that we get answers on that specific part of the CARES Act reimbursements.
And this is just one more follow-up from Hannah for Dr. Ezike.
Sure.
Had you seen the list of 50 counties with the highest death rates where the vaccine would go when the governor's office announced it on Friday? Did anyone check to see if there were hospitals in each of those counties?
Okay.
No, go ahead.
Okay. No, the metric that was going to be used, the methodology was chosen without respect to what it would show. So the methodology was chosen, and then the data team identified which counties that would be. And then after we see the counties, then we try to identify the hospitals that would be in those counties, and then we see that some of those counties don't actually have hospitals.
Mm-hmm.
Yeah, and remember, this is, if you want to save lives in a county that's being served by a hospital that doesn't happen to be in that county, then it makes sense to have vaccines provided at the regional hub.
Governor, your answer to the question the other day wasn't entirely clear. Was there specific information uncovered at the LaSalle Veterans Home that led to the firing of the administrator earlier this week? If so, what was it? That's from Dan Petrella at the Tribune.
There were lots of pieces of information. I think we've been actually very transparent about the things that we've learned so far. There's certainly more that we can learn, but what I want to do is make sure that we're keeping each of the residents as safe as humanly possible. And if there were failures of management there, and we talked about some of the things that had gone on at that LaSalle Veterans Homes. Those are things of great concern to me. I want to make sure that we plug all of those holes, and making sure that we have the right management helps do that.
All right. Thank you.
Thank you, everyone.
Right, we did make brokerage changes though in 2019. That's where I said we increased it from 20 to 22%, so we did raise the hurdle.